Please welcome CEO of Philips, Frans van Houten.
Hi, good morning everybody. It's great to be here at ViVE. I am very excited to be here in person. Pre-COVID, I think we may have underestimated the importance of really getting together on such events. And now after more than 2 years with the pandemic, we seem to be finally emerging from this long drawn out crisis. Now I would be remiss to not mention that we are now facing other challenges in the world, very worrying, which is the devastating war in the Ukraine. And all our hearts go out to the people there. We all know that that is a hugely important issue. Today, I want to focus on how we can work together on improving the value and impact in healthcare. We all recognize that healthcare is faced with, on the one hand, more patients and inequity among the patients, and on the other hand, less money and a huge shortage of staff. Actually, the staff shortage is the most pressing issue for hospital CEOs, according to the latest survey of the American College of Healthcare Executives. Last time that this topic topped the list was nearly 20 years ago. Sorting it out is a top priority. After all, the numbers back up the concerns. It's reported that 8% of all jobs in healthcare are currently open, at a time when there are 400,000 fewer healthcare workers compared to before the pandemic. And that is staggering. But actually it is not only confined to the United States. Healthcare leaders that I talk to around the world want to address this head on. They want to ease the burden on the staff, improve their experience, for one, so that staff don't walk away. But at the same time, and it sounds like a conundrum, they're also keen to improve productivity, next to improving patient experience, delivering better health outcomes. So all of that comes at a time when new care models need to be invented and are emerging. The premise is attractive, no doubt. Innovation can really help, but that can also overwhelm doctors and nurses, for example, with an explosion of data and even more administrative burden. Therefore, care providers need to figure out how to make sense of what often appears to be conflicting objectives. And more than before, providers realize that they need new strategies to fundamentally deliver the breakthroughs that are needed on the items that I mentioned. Besides innovation, they also want to have support in how do you make the shift, how do you make the change in their large organizations that sometimes feel a bit entrenched with the day-to-day work burden. Today, I'm obviously going to make the case for embracing the transformation of healthcare, the theme of ViVE, whereby we can reimagine end-to-end workflows, care pathways, the relationship between caregivers and patients. I will also make the case for the central role that both innovation and partnerships can play. In fact, these can help you address the staff shortages that I spoke about and raising productivity at the same time. Now, having transformed Philips as a CEO, I do think I know how hard it is to accomplish organizational change. But I also know it can be achieved with perseverance and, most importantly, with a compelling vision. To help make the case here today, I'd love to take you on a journey with a few examples to bring it to life. With your permission, let's start at the radiology department. Here's where we are confronted with aging population, along with increasing numbers of people with comorbidities. We have currently big patient backlogs. Many hospitals are struggling with aging equipment and not enough technicians. All in all, radiology departments face significant challenges. Strong conviction is that digital technologies can really help bring practical solutions to ease today's burden. And sometimes these solutions are nearer than you think. Let me start with the simple task of patient scheduling. Did you know that around 7% of patients actually do not show up to their appointment? That has a huge knock-on effect, because then we need to reschedule. That costs time, that costs money, it adds pressure on the staff, not to mention the wasted capacity of the machine and the installed base. Now, what can help? It's actually simple: communication software. The Philips Patient Navigation Manager, for example, has allowed health systems that adopt it to achieve an 80% reduction on same-day cancellations and a 48% reduction on no-shows. Moreover, the communication software empowers the patients with alerts, with information, so that they come well prepared to their appointment. It thereby improves the patient experience, but it also enhances the patient-physician relationship. It is simple and effective. It is at our fingertips today, really, and it can immediately enhance capacity utilization. Now let's take this a few steps further. So the patient arrives on time for their appointment, and now they are ready to meet the radiology technologist or clinician for their examination. But what if this clinician is junior and struggling with his or her task? Or maybe he or she calls in sick in the morning. Also here, there are breakthrough solutions available to help. We offer a vendor-neutral radiology operations command center that connects imaging experts in a central location with the local community diagnostic sites, providing the ability to virtually operate the scanners remotely and keep the shop running. It also enables imaging experts to communicate with the technologist on site, such as the more junior people that I spoke about, who are still getting up to speed on the job, supporting them in setting the right protocols in real time, with imaging experts answering questions while the patient is on the table. It also enables on-demand cross-training and procedure assistance. A clinical manager said that this technology was, and I can quote from her, able to help us identify a critical finding, an acute brain tumor, when a junior radiographer reached out from a remote center for assistance with something that they saw on an MRI scan. This all took place in real time, and the team was able to notify the patient's referring doctor immediately. This is so much better than having to do a rescan and call the patient back for a second time. What if radiologists can also significantly reduce their reporting time while increasing the value of their reports? The challenge for radiology is top of mind, and digital solutions can help with the orchestration. AI can play a role to ensure that the most important scan is on top of the list. That whole work planning brings peace of mind for radiologists. All of this is technology, part of our ViewPAX platform, that can deliver state-of-the-art reports that save time, but also a reduction of turnaround time of some 40%. Obviously, I've given you now a few examples in radiology that are the promise of digital technology. It helps improve staff experience, boost productivity, enhance capacity utilization, thereby increasing revenue and reducing cost for the healthcare institution. It also helps clinicians with smarter workflows, reducing fatigue, and helping people to focus more on the patient. These are some of the outcomes, I think, what we want to see. I'm making the plea for a faster adoption of digital technologies because as COVID has shown, when we are really pushed, we can actually adopt new technologies at great speed with real impact. It just needs that encouragement from us, you. Now let me take you on the next stop of the journey, and this time I'd like to talk about oncology. As we know, cancer is a complex disease to manage for patients as well as the medical professionals. It requires the analysis of data across radiology, pathology, genomics, many other domains, requiring a longitudinal assessment of the patient history, literature comparisons on similar cases. Yet the time to assess a patient versus the time available is a big tension. It's a terrible tension, actually. And it puts stress on the medical staff, dissatisfaction, really. And this dilemma calls for novel approaches to keep oncology care manageable, scalable, sustainable, especially when you realize that the incidence of new cancer cases is expected to increase by 70% over the next decade or so. So what could be the approach here? We have, together with leading clinics, innovated what we call the oncology orchestration. You can see from the word orchestration that we think end-to-end in terms of workflow. It supports oncology care providers in detecting cancer sooner, diagnosing more precisely, targeting the right treatment for the right patient, and learning from patient cases through continuous learning and improvement of performance. Now, every week, even every day can matter when it comes to diagnosing cancer. In lung cancer, diagnosing and starting treatment a week sooner actually results in a 4 to 5% increase in survival chances. And we certainly need to get this back on track when we think about cancer screening. In the United States alone, it's estimated that COVID has contributed to some 9.5 million missed cancer screenings. And we all know that early detection can drive the change we need. So, oncology orchestration streamlines and connects workflows across departments, as opposed to what historically was always done to innovate within a department. Right? The case for change is here to go across, whereby we can embrace artificial intelligence to automatically bring all relevant data together, extract it from all the sources, so that the multidisciplinary team can discuss the case, characterize the tumors, compare literature, and determine the best treatment pathway. When information is delivered in a way that is simplified, standardized, automated, care teams receive a comprehensive overview of their patient's cancer care pathway, from diagnosis to treatment to follow-up, thereby giving doctors more time with patients. In the military terms, this would be called a mission briefing. A clinical study conducted at Karolinska University Hospital in Stockholm in Sweden shows improved confidence in decision making as rated by 80% of the oncology care team members when using the oncology orchestrator and informatics solutions. It improves the efficiency in the discussion. For example, a prostate cancer patient in a tumor board conference could be handled in 24% less time per patient case, freeing up time for the more complex patients, perhaps. In decision making, and especially when deciding the optimal treatment for the patient, the oncology team is often facing challenges of keeping up with the continuously expanding and updated guidelines. Now, to address that, Philips partnered with the Dana-Farber Cancer Institute on translating these textbook-like guidelines to pathways, but also digitalizing them so that they could be embedded in clinical informatics and decision support systems. Now we can match the patient and tumor characteristics to these best-in-class pathways. The oncologist and the care team are supported in finding and selecting the optimal treatment in a personalized yet evidence-based manner. This can lift the standard of care across the nation, also in less privileged institutions. But it again comes down to the adoption of digital technologies. Ladies and gentlemen, in the spirit of taking you on a journey, let's now venture beyond the walls of the hospital for a moment. My third example, inspired by experiences during the COVID pandemic, I know many of you have experimented and now are keen to further explore the adoption of virtual care. I'd therefore like to tell you about a case study of West Moreton Health in Australia to illustrate how they have adopted virtual care and are seeing great results. For those of you less familiar with Australia, the West Moreton area includes both a metropolitan area as well as rural community settings across a wide range of territory, with a relatively high percentage of people with low socioeconomic status, where the social determinants are really at work. Now, West Moreton Health was looking for a way to help patients with chronic conditions, for example, chronic heart failure, to achieve better health and well-being while keeping the cost of delivery sustainable over the long term. In 2016, so that is 6 years ago, West Moreton Health and Philips formed a partnership to introduce what is called MeCare. The program is built on the Philips eCare Companion telemonitoring platform. It's an open platform with APIs, and West Moreton has tailored their health management plans on top of it to help chronic ill patients take control of their own health. The results show that the program has strongly improved patients' quality of life, including increased confidence and mental health, while keeping their physical health conditions stable. It has actually led to a 35% reduction in hospital return visits within the program. The Australian Centre for Health Services Innovation found that the MeCare program delivers a median cost saving of around $1,200 per participant per month, and that year after year. Now, in the US this would be much higher given that the rates are higher. But that's not all. Dr. Carrie Freeman, she's the CEO of West Moreton Health, quoted in the Philips-sponsored Harvard Business Review Analytical Services series, she said, "Our patients actually say that it changed their lives." She then goes on to say that patient-reported experience measures are through the roof. They feel they have a guardian angel. They have chronic conditions but are able to have a much better quality of life. They're getting proactive care before they get into a personal crisis. They are loving life again. End of quote. So with that and my 3 examples, let us now zoom out. I covered an example in radiology, in oncology, in virtual care, and all show the advances that are possible in boosting efficiency, increasing care capacity, while ensuring a better patient and staff experience. These are very powerful benefits. But to achieve these impacts, it requires a very significant change in the work practice in your institution. And we all know that change is not easy. And this is why, next to just saying, please adopt digital technologies, I want to argue for the huge benefit of so-called collaborative partnerships, whereby the traditional vendor relationship is substituted for a multi-year, outcome-oriented partnership where you can co-create and are co-accountable to reach the results. Strategic partnerships offer value. They present a new business model to to help healthcare leaders expand access to advanced medical care and new technologies to improve patient outcomes, while also being able to better manage cost and get a handle on the complexity of your technology investments, because the CIOs here in the room, you know how hard it is to manage that dispersed installed informatics base. In the Future Health Index 2021 report, came out last year, 41% of healthcare leaders said that their hospital or healthcare facility wants to prioritize strategic partnerships and collaborations in order to successfully implement digital technologies. I actually have no doubt that when we do the study this year, the number will be even higher. And that's because through partnerships, healthcare leaders can gain access to strategic guidance, a collaborative approach, opportunity to co-innovate and co-create solutions, but also learn from best practices in other institutions in an easy way. Moreover, you gain a partner who commits to continuous improvement, as well as risk sharing and sharing accountability for the outcomes that you seek, thereby a partner. Now, for those partnerships to truly succeed, they need to be built on a shared vision, a North Star, targeting outcomes rather than inputs. We all need to work along the same metrics. They require deep sharing, a building of trust, and an open systems integration. And then together we can bring the people along on a journey to change. Bringing people along, in my experience, is a combination of providing focus and direction, motivation, removing barriers, but also entrusting people to work in an agile manner, step by step on that change journey. At Philips, we are very excited about the transformation of healthcare, leveraging innovation, introducing digital technologies, and adopting new partnership models. We are excited to be on this journey with our customers. We strongly believe that in this way, we can together deliver on the quadruple aim of healthcare, of better health outcomes, better cost and productivity, and a better patient and staff experience, and thereby creating long-lasting value in healthcare. Ladies and gentlemen, thank you very much. I hope you have a great conference.
Thank you, Frans.